This is Steve Max of the Democratic Socialists of America, and this presentation will explain why our organization supports single-payer national health care, also known as Medicare for All, or the Conyers Bill 676. It's true. The World Health Organization ranked all of the member countries of the United Nations, and the United States healthcare system came out 37th from the top in overall performance. France was number 1. San Marino, which is almost too small to count, was number 2, and Italy number 3. All have some form of single-payer system, which means that one government agency pays everyone's hospital and doctor bills out of tax revenue instead of each individual buying private for-profit health insurance or getting it through an employer. How did we get to this point? This presentation will explain that it is because we rely far more heavily on private for-profit insurance companies than any other industrial country. When we say per capita, we mean literally per head. That is, all the money divided by all the people. The figure changes from year to year, but is over $6,000. This statistic is useful for comparing spending in different countries. The U.S. spends roughly twice as much per capita as any other advanced country. Other countries have found that private for-profit insurance is an expensive and inefficient basis for a healthcare system. We pay premiums, and if we don't get sick, the insurance company keeps our money for its profit. If we do get sick, the company tries to keep it anyway, and we have to fight to get the bills paid. When some procedure isn't covered, the provider comes after us personally for the money. On top of it all, the insurance companies invest our premiums in the stock market, and who knows where that can end up. This chart will compare healthcare spending per capita in a sample of the major industrial nations. It shows where the money comes from. There will be a bar for each country. The dark blue portion shows public spending, such as Medicare and Medicaid. The white part shows out-of-pocket costs, such as deductibles and copays. The light blue part shows what is paid by private insurance companies. The third bar from the left, the label above which has just turned red, is the average for the 30 countries in the Organization for Economic Development and Cooperation. The U.S. is right in the same ballpark as the other nations when it comes to public spending and out-of-pocket spending, but you can see that no other country has as much money coming through private insurance companies as we do. PNC is a bank and investment company. For whatever reason, they did this survey, and here is what they found. 96% of all claims must be submitted more than once. 1 in 5 claims are delayed or rejected. Insurance companies go back to hospitals at least twice for each claim. All of this reflects the waste inherent in private for-profit insurance. The hospitals know that their claim will be cut back, so they bill for more in order to come out even. The insurance companies know that hospitals are billing for more, so they reject the claims and pay less. Ultimately, we, the consumer, pay for the paperwork. A trustee at the Duke Hospital revealed this astonishing fact. The Congressional Budget Office found that administrative costs under the public Medicare plan are less than 2% of expenditures, compared with approximately 11% of spending by private plans that are part of the Medicare Advantage system, which is basically the same program but administered by private for-profit companies. We're going to compare WellPoint, the largest U.S. health company, to the Ontario healthcare system to see how they stack up in administrative costs. When this study appeared in the New England Journal of Medicine, WellPoint Insurance was just a little smaller than the Ontario system, the Canada single-payer healthcare system. But look at the difference in the number of employees administering the system. In general, almost a third of every American healthcare dollar goes for administration. In Canada, it's only 16%. Single payer isn't about what services you get or how quickly you get them. It is about only one thing: who pays the doctor and where the money comes from. Instead of everyone having to find their own health plan, all expenses are covered by a single agency that is funded out of taxes. We hear all the time that we as a nation can't afford to cover everyone, especially the 46 million people who currently have no insurance. If we're talking about continuing the present system of private for-profit insurance, that may well be true. However, going to a single-payer system allows us to reorganize the money we are already spending on health care in a more rational way. When we say that America spends over $6,000 a year per person, that statistic includes the 46 million who have no insurance, even though they may not actually receive the care. Canada and France spend half as much and cover everyone. And remember, France was rated number 1 in overall performance by the World Health Organization. Instead of allowing a fair debate on single payer, committees in Congress have been discussing plans based on private for-profit insurance, with the possibility of an additional option that would be similar to Medicare, the public option. DSA endorses single payer, but supports the inclusion of a public option in any plan that Congress can pass. However, the public option has to be real. Money saved on administration and from not paying for insurance company advertising, executive salaries, and profits should go directly to lower premiums for plan members. The insurance industry doesn't want the public plan to be less expensive than private insurance and is working to get provisions included that will prevent it. The public option should operate with the same advantages and the same responsibilities as the private insurance companies in a new national plan. The industry will try to rig the game so that older, sicker, and poorer people go into the public plan, while private plans get the people who are less likely to be sick. This has to be prevented. When the private for-profit plans receive subsidies to cover people who can't afford insurance, the public plan should receive the same subsidies. The industry wants money withheld from the public plan so that it can claim that public plans don't work. We hope you've enjoyed this presentation. This is a photo of some of the members of Young Democratic Socialists. For more information on DSA and YDS, go to www.dsausa.org.